Today I am going to discuss about the urinary tract infection because this is a very common problem in the females. More than 50% of the females world over, they suffer from UTI once in their lifetime. Why it is more common in females? Because they have shorter urethra as compared to their male counterparts. The symptoms with which the patients they come to the doctors are burning micturition, frequency of urine, pain lower abdomen, fever, chills, and even blood in the urine. If patient comes with these symptoms, doctor gets two tests done. One is urine complete examination and second is the urine culture. In urine complete examination, if the urine shows presence of bacteria or more than 7 to 10 WBCs, or if leukocyte esterase test is positive or there are nitrites in the urine, that means the patient is suffering from UTI. The urine culture is done for two purposes. Number one is to find the pathogen and secondly to find out the antibiotic which will be best to treat the patient. So both the tests, urine complete examination and urine culture, they are very important to diagnose and treat the patient. The most common pathogens which cause UTI are Escherichia coli in 75 to 80% of the cases. In 10% of the cases, it can be Staphylococcus saprophyticus, which is commonly found in newlyweds. And in diabetics, we commonly find yeast infection, and catheterized patients or bedridden patients, there could be Pseudomonas infection. The patients who have stones, urinary stones, there can be chances of Proteus or Klebsiella infection. So accordingly, the patient is treated with the antibiotics, and it is my suggestion that at the end of the treatment also, the patient should get the urine culture done. Otherwise, the patient can have recurrent UTI. What is recurrent UTI? That means if the patient has 2 or more episodes of UTI within 6 months or more than 3 episodes in 1 year, we call it recurrent UTI. Some patients are more prone for recurrent UTIs as compared to the others because of the genetic predisposition. But we cannot work much on that. But to avoid avoidable factors like renal stones and vaginal dysbiosis, we can always work on. Few of the precautions which should be taken by the females are: number one, drink plenty of fluids including lemon water, but avoid high calorie and sugary drinks. Maintain proper menstrual hygiene. Maintain sexual hygiene. Pass urine before and after the intercourse. Avoid washing the perineum again and again after micturition. Do not apply lubricants and oils, deodorants, etc. in the area. Avoid cleaning the hair with hair removers or razors because they can give you ulcerations or cuts or can produce the allergic reactions in the area. Pass urine whenever you feel full, and take more of antioxidants which are rich in proanthocyanins like cranberries, blueberries, and fruits and vegetables which are rich in colors. Always take vitamin C in plenty and wear cotton panties, and whenever you feel full, always pass urine. These are few precautions which can be taken by the females to avoid recurrent UTIs. Thank you.